Hi everyone, welcome to our second Town Hall update. My name is Kim Skur. I'm the Vice President of Operations for UCSF Health, and I'm joined today by Dr. Hanmin Lee, Surgeon-in-Chief at the UCSF Benioff Children's Hospitals. I'm also joined by Dr. Diana Montgomery, Private Pediatrician at Private Medical. Thank you both for being with us today. So first, I would like to just say that UCSF Health continues to follow the orders of our San Francisco Public Health Department as they allow us to open up to more patients in the UCSF health system. Today, we know that you're interested in a number of different topics related to COVID-19, and we are going to be asking our physician experts some of the questions that might be on your mind. So the first question I'd like to ask is to Dr. Montgomery. Dr. Montgomery, there has been a lot of concern about a COVID illness in children. Would you like to help explain that and whether there is need to be concerned?
The good news about COVID-19 in children is that it really does not seem to affect children, most children, very severely. There are two things to think about when we do think about severe disease in children. One is severe disease from COVID-19 itself. That thankfully, in the data that we have from around the world and from the United States, shows that children really are very unlikely to have serious disease from COVID-19. So that's really good news. There has been a lot in the media lately about something called a multi-inflammatory syndrome, which is thought to be related to COVID-19. This is not the same at all as the disease that we're seeing from the infection itself. This is an immune response that happens after infection that causes inflammation in lots of different organ systems. This is very, very rare. It's making the news a lot because it's something new, but the numbers are very, very small, and so not something that I think most of us need to be concerned about for our own children or our community.
And Diana, just for clarification and reassurance to parents watching, would a parent recognize that there are symptoms, not necessarily of this disease, but symptoms enough that you would be calling your pediatrician and they could actually be deciphering what might be wrong and if your child needs to be taken in to be seen?
Yeah, I mean, I think this is a really good time in general to make sure you have a good relationship with your pediatrician, and I would be pretty free about calling your pediatrician for advice with really any symptom. Certainly with fever, that could be one of the most significant findings in this multi-organ system inflammatory disease. But for COVID-19 itself, it's actually important to note that children don't necessarily present with fever. They don't even necessarily present with cough or respiratory symptoms. So really important to just be in touch with your pediatrician's office if there's anything that doesn't seem right with your child.
Thank you so much. And now we're going to turn to Dr. Hanmin Lee, our Surgeon-in-Chief at UCSF Benioff Children's Hospitals. And Dr. Lee, as California has, seemingly flattened the curve for COVID cases, UCSF Health and UCSF Benioff Children's Hospitals are opening now to more patients and surgeries that may have been delayed that we would like to have patients come in and have those surgeries or procedures performed. Can you take us through the processes that UCSF is undergoing to ensure safety as we start to open up the hospital to additional patients?
Thanks, Kim. As you know, this is an unprecedented time in healthcare. And when we started seeing cases of COVID-19 throughout the United States, and the epidemiologists were worried that we were going to have hospitals full of patients with COVID-19, we had to take this very seriously, and our whole hospital team mobilized to try to do things that were safe and necessary. As we've flattened the curve, we know that we can do more procedures, more admissions, more tests safely. We have instituted policies to test everybody who walks through the hospital doors, staff, patients, as well as family members. And every patient to the Benioff Children's Hospital that gets admitted or has surgery will get COVID-19 testing prior to their admission or surgery. And that's both to protect them so that they don't undergo medical testing and procedures while they may be COVID positive, as well as other members of our healthcare community. So we are doing everything that we can to be safe, and that includes social distancing within the hospital.
Yes, thank you so much for saying that, because I think at UCSF Health, as we start to move forward, we really want to make sure that we are just operationalizing visitor screening. As you mentioned, we still are limiting visitors to the hospital, but caregivers and visitors are screened at the front door, and then patients who are undergoing non-emergent surgeries and procedures are having COVID testing prior to admission. In addition, Family House has also instituted the same screening protocols that we have at UCSF Health for their caregivers and patients who are staying at the house. They've also instituted a number of other infection prevention, social distancing, trying to not have groups gather, having meals delivered to the room, etc. Thank you for participating in this town hall. We are thrilled that Family House remains open, remains a refuge for families and our patients, that through technology, we're able to have virtual support groups, children are still doing artwork, families are still having meals together, they are still able to be together as a unit away from the hospital. Family House remains a home away from home for our sick children, and we will continue to be conservative in our infection prevention in order to ensure the safety of everyone who is at Family House. Thank you and have a great day.